Stabenow's next. We all saw those pictures of Michigan, and I know my colleague is very, very determined to fix these problems, and we appreciate it. Senator Stabenow.
Well, thank you very much, Mr. Chairman. And first, welcome. I know we have survivors of Michigan facilities and Michigan advocates here. Welcome. Thank you very much for being here. And I just want to thank the staff that put together this report and all the important efforts here. This is really significant, really important investigation, and thank you for bringing this out. And it's true, in 2020, we saw the devastating death of Cornelius Frederick. He was 16 years old, living in a residential facility in Kalamazoo, Michigan. And after simply tossing sandwich crust at some nearby young people, Cornelius was knocked to the floor and restrained by 7 staff members over the course of 10 minutes. 2 days later, he passed away. This is a horrible tragedy. It's horrible what happened. And I know, based on what the comments here and the reports and so on, that this is not an isolated instance, which is why we're here today. It's wrong and it's indefensible. The stories of harm to children while in care only highlight the need for strengthening investments in community-based models. And I just want to emphasize again, we actually have good news on this front. First, let me go back, though, to say that President John F. Kennedy, the last bill he ever signed before his own death in 1963 was the Community Mental Health Act. It had 2 visions, one to eliminate what were called asylums at the time, and the other was to provide comprehensive community care, which we have not done until this point. And we now have, through a model that 20 states are receiving full funding for now through Medicaid, a healthcare model called Certified Community Behavioral Health Clinics. We have services being provided, over 500 clinics across the country, more that needs to be done, and certainly more to be understood, because this is a new model, comprehensive model, based on federally qualified health centers, funding behavioral health care as health care. But this is a really important model for us to be embracing, I believe. CCBHCs provide comprehensive services. They're equipped to care for children and youth with complex behavioral health needs, everything we're talking about today. According to the 2020 Department of Health and Human Services report on the first 8 states being funded for these clinics, about 1/4 of the patients are children and adolescents. And just last week, the National Council for Mental Wellbeing's latest report on the impact of CCBHCs nationwide, and by the way, they've said that one of the most important ways that services have been expanded through these clinics is for young people, services for young people. The same report showed that 82% of the clinics have established teams that are specifically child and youth focused. 82%, which is good news. And 83% of the clinics provide services in one or more school setting. So we're talking about clinics that require 24-hour psychiatric crisis services, comprehensive services. Anybody who walks in the door can get care based on a healthcare model. And I hope, Mr. Chairman, we're going to be embracing and looking more at what is actually happening now to meet some of these issues. Obviously, we need inpatient, that's quality care also. But we are, in fact, moving forward on comprehensive behavioral care, and I hope we're going to be embracing this more and more. Ms. Stanford, in your testimony, you emphasize that there's a, quote, pervasive assumption that children's complex behavioral health needs can't be met in community-based settings. And you've talked about that today, which I appreciate very much. Could you talk more about the strategies you would suggest to help counteract that assumption?
I think things like what we're doing here today is getting people to understand what residential treatment is actually providing is the first step. It is something that we've been trying to do for 5 years and thought we'd be further along in by now. But if people think that there's an answer, they're not looking for a solution. So people think that if this is the place where you get that kind of treatment, they're not looking for those community-based treatment options. And a lot more research needs to be done in what could be effective in proving that those models can work so that they can be implemented for children.
Yeah, absolutely. Thank you. And Ms. Meyer, I know I'm out of my time here, but I agree with you. We've got to do more to establish clear pathways for community-based care. You mentioned New Jersey doing good things. I just want to say they are one of the first 8 states to receive full funding for what I just talked about, community behavioral health clinics. And my guess is that is the services and funding that they're receiving in New Jersey to do what they are doing. So I would encourage us to really look more at this opportunity that we fully funded finally through the Safer Communities Act 18 months ago. The funding is there, the model is there, and I hope we're going to move forward and embrace it more specifically. Thank you, Mr. Chairman.
Thank you, Senator Stabenow. And for those of you that haven't followed all of this debate, it's very hard to do so. We understand on this committee that there are several pieces to this puzzle. For example, the behavioral health effort that Senator Stabenow has led. Our whole committee on a bipartisan basis worked very hard to get some of those key provisions in other legislation. Chairman Hatch worked with all of us to pass a historic set of reforms called Families First. So what we're talking about today is essentially building on that progress, recognizing that the abuses that we're looking at specifically as it relates to these residential treatment facilities, they're a key part of this puzzle. We're not going to fix this unless we address it. And as we do so, we're going to try to build on matters like Senator Stabenow's legislation, Families First, and other measures. Senator Casey has been a great